An anticholinergic agent is a substance that blocks the neurotransmitter acetylcholine in the central and the peripheral nervous system. Anticholinergics inhibit parasympathetic nerve impulses by selectively blocking the binding of the neurotransmitter acetylcholine to its receptor in nerve cells. The nerve fibers of the parasympathetic system are responsible for the involuntary movement of smooth muscles present in the gastrointestinal tract, urinary tract, lungs, etc. Anticholinergics are divided into three categories in accordance with their specific targets in the central and/or peripheral nervous system: antimuscarinic agents, ganglionic blockers, and neuromuscular blockers. Medical and recreational uses: anticholinergic drugs are used in treating a variety of conditions: gastrointestinal disorders, genitourinary disorders, respiratory disorders, sinus bradycardia due to a hypersensitive vagus nerve. Insomnia, although usually only on a short-term basis. Dizziness. Anticholinergics generally have antisialagogue effects, and most produce some level of sedation, both being advantageous in surgical procedures. When a significant amount of an anticholinergic is taken into the body, a toxic reaction known as acute anticholinergic syndrome may result. This may happen accidentally or intentionally as a consequence of recreational drug use. Anticholinergic drugs are usually considered the least enjoyable by many recreational drug users, possibly due to the lack of euphoria caused by them. In terms of recreational use, these drugs are commonly referred to as deliriants. Because most users do not enjoy the experience, they do not use it again, or do so very rarely. The risk of addiction is low in the anticholinergic class. The effects are usually more pronounced in the elderly, due to natural reduction of acetylcholine production associated with age. Exceptions to the above include scopolamine, orphenadrine, dicyclovarine dicyclomine and first-generation antihistamines with central nervous system penetration. Side effects. Possible effects of anticholinergics include ataxia, loss of coordination, decreased mucus production in the nose and throat, consequent dry, sore throat, xerostomia or dry mouth with possible acceleration of dental caries, cessation of perspiration, consequent decreased epidermal thermal dissipation leading to warm, blotchy, or red skin, increased body temperature, pupil dilation, consequent sensitivity to bright light, loss of accommodation, double vision, increased heart rate, tendency to be easily startled, urinary retention, diminished bowel movement, sometimes ileus, increased intraocular pressure. Dangerous for people with narrow-angle glaucoma. Possible effects in the central nervous system resemble those associated with delirium, and may include confusion, disorientation, agitation, euphoria or dysphoria, respiratory depression, memory problems, inability to concentrate, wandering thoughts, inability to sustain a train of thought, incoherent speech, irritability, mental confusion, wakeful myoclonic jerking, unusual sensitivity to sudden sounds, illogical thinking, photophobia, visual disturbances, periodic flashes of light, periodic changes in visual field, visual snow, restricted or tunnel vision, visual, auditory, or other sensory hallucinations, warping or waving of surfaces and edges, textured surfaces, dancing lines, spiders, insects. Form constants, lifelike objects indistinguishable from reality, phantom smoking, hallucinated presence of people not actually there. Rarely, seizures, coma, and death, orthostatic hypotension and significantly increased risk of falls in the elderly population. A common mnemonic for the main features of anticholinergic syndrome is the following: blind as a bat, red as a beet, hot as a hare, dry as a bone, mad as a hatter, the bowel and bladder lose their tone, and the heart runs alone. Remedies. Acute anticholinergic syndrome is completely reversible and subsides once all of the causative agent has been excreted. Reversible cholinergic agents such as physostigmine can be used in life-threatening cases. Wider use is discouraged due to the significant side effects, such as rapid heartbeat and decreased blood pressure. Piracetam, I plus or minus GPC and choline are known to activate the cholinergic system and alleviate cognitive symptoms caused by extended use of anticholinergic drugs. Pharmacology. Anticholinergics are classified according to the receptors that are affected. Antimuscarinic agents operate on the muscarinic acetylcholine receptors. The majority of anticholinergic drugs are antimuscarinics. Antinicotinic agents operate on the nicotinic acetylcholine receptors. The majority of these are non-depolarizing skeletal muscle relaxants for surgical use that are structurally related to cure. Several are depolarizing agents. Examples of common anticholinergics: antimuscarinic agents, atropine, benztropine, biparidone, chlorpheniramine, dicyclomine, dimenhydrinate, diphenhydramine, doxylamine, glycopyrrolate, ipratropium, orphenadrine, excitropium, oxybutynin, tolterodine, sheetropium, trixifenadil, scopolamine, sulfenachine, tropicamide. Antinicotinic agents: bupropion, ganglion blocker, dextromethorphan, cough suppressant and ganglion blocker, doxycurium, non-depolarizing skeletal muscular relaxant, hexamethonium, ganglion blocker, mecamulamine, ganglion blocker and occasional smoking cessation aid, tubocurarine, non-depolarizing skeletal muscular relaxant. Plants of the Solanaceae family contain various anticholinergic tropane alkaloids, such as scopolamine, atropine, and hyoscyamine. Physostigmine is one of only a few drugs that can be used as an antidote for anticholinergic poisoning. Nicotine also counteracts anticholinergics by activating nicotinic acetylcholine receptors. Caffeine is able to counteract the anticholinergic symptoms by reducing sedation and increasing acetylcholine activity, thereby causing alertness and arousal. Plant sources: the most common plants containing anticholinergic alkaloids are Atropa belladonna, source of atropine, Brugmansia species, Datura species, Hyoscyamus niger, Mandragora officinarum, use as a deterrent. Certain preparations of some drugs, such as hydrocodone, are mixed with an anticholinergic agent to deter intentional overdose. References